Today we're going to talk about 3 different yoga positions, poses that you can use to help with functional bowel disorders, specifically constipation. So we're going to begin on our backs with our feet flat and our knees bent. So once you've settled into this position, we're going to take one knee into the chest. Go till you feel a comfortable stretch in the back of the hip, maybe in the lower back. And then bring the other knee into the chest. So for the first position, it's called passing wind pose. We're going to take the hands on top of the knees. We inhale as we bring the knees away from the chest and the arms straighten. We exhale as we bring the knees into the chest, as far as we comfortably can. We inhale, move the knees away. Exhale, bring the knees towards. Inhale, move the knees away. Exhale, bring the knees towards. And we'll continue like that as long as it seems meaningful. Usually I have my patients do 5 to 10 repetitions. Moving with the breath. And then the next pose, we're going to keep our hands in a similar position, maybe rotate them out so the fingers are facing each other and the palms are hugging the outsides of the knees. But again, make this comfortable for your arms and wrists. And it's going to be similar in that we're going to inhale the knees away, but this time we're going to start to make some knee circles or some trunk circles as we bring the knees towards the chest. And then inhale as we bring the knees around the chest. So I'm starting with an exhale, bringing the knees over to the right and in. And then I'm going to inhale as I bring the knees away and straighten the arms. So there's an exhale, bring the knees around. Inhale as I bring the knees away. So very similar to the passing wind pose, but adding a little bit more of a rotation and a twist. After you've done about 5 to one side, then we'll go and we'll do it to the other direction. So inhale and exhale. Inhale and exhale. Inhale and exhale. And then from this position, we can go into a spinal twist. Now, it's harder to do the spinal twist with your feet off the floor, so I'm going to demonstrate putting the feet down on the floor and bringing the arms out to a wide position. From here, we're going to allow the knees to come over to the right side. Once you find a place where you're comfortable, you take a blanket or a block and place it under the thighs of the knees just to give yourself a little bit of a stop. From here, you can take your top arm and lay it on top of the top leg just to give yourself a little bit more, we call it an assist, a little bit more stretch through the hip. And then you can turn your head, if it's comfortable, to look over towards the left. And in this position, we combine the rotation with the breath. So calming down the nervous system, facilitating the parasympathetic nervous system with longer, slower exhales. And also encouraging that movement of the bowels through the breath and through the rotation. And then you can take your top hand and you can give yourself a little bit of a bowel massage. Reach behind your back and give yourself a little massage from the back. And you combine the breathing with the massage, usually staying in this position for 5 breaths. When you're ready to transition to the other side, take a breath in and gently squeeze your pelvic floor to give yourself a little bit more stability. And bring your knees over to the other side, placing the blanket under the left knee, arms out to the wide. Left hand can rest on the top knee or thigh, and then the gaze is over to the right. And again, combining the twisting with the breathing. Bringing the right hand in and doing a little bit of massage. Ascending colon, maybe reaching around and massaging a little bit into the back. Since we know that the intestines are fairly deep in the abdominal cavity, reaching around to the back can sometimes afford a little bit more mobility. If that's not comfortable to your wrist, you can also kind of get from behind and using a fist to give yourself a little self-massage. And after you've been here about 5 breaths, then take another breath in, breathe out and gently squeeze your pelvic floor to give yourself a little more stability, and come back to the starting position. Rest here for a moment, take a couple of breaths before rolling to your side and coming up to a seated position.